Hi everyone, and welcome to today's webcast. My name's Twyla, and I'd like to welcome you to today's information sharing and working with the Persons with Developmental Disabilities program cast. So before we get started with the webcast presentation, I'd just like to mention that these webcasts are part of a larger joint initiative by the Government of Alberta called the Community and Social Services Learning Series. For more information about the service series, please check your emails for regular updates or go to the csslearningseries.ca. We encourage you to pre-register for the upcoming webcasts online so you don't miss any of the future programming. During our webcast today, you'll be able to ask questions via our live chat window. If you've yet to access the chat, I recommend that you try it out now. Scroll down from your viewing window to access the chat. When using the chat window, it will allow you to get the most out of today's presentation, so we encourage you to participate and write questions or comments. Nicole is our online monitor today, and she will give you our web chat questions to our presenters during the question and answer period, and they will try to answer as many as possible during today's session. The session is also being recorded, and the video will be posted on the csslearningseries.ca website about 2 weeks after this session. You can browse through the past webcasts there and rewatch any that you might have missed. So now let's get started. As we go forward with this webcast, I'm going to turn it over to George to start us off.
Good afternoon. My name is George Alvarez, and I'm the lead for the Knowledge and Information Management area within Community and Social Services and responsible for the implementation of an information sharing strategy. So as I'm going to be talking today, I'll be focusing primarily on the information sharing and the way that it mixes or informs the work that is being done by PDD. The objectives today are really to ensure that you have a good understanding about the information sharing strategy, so a bit of an overview on that. We're going to look at some of the best practices for information sharing in the collaborative and integrated services delivery models. And then we'll be talking about the draft PDD information sharing policy, the updates to that policy. We'll discuss notification and consent. And we'll also be talking about the draft PDD health and safety document summary. And then at the end, we'll take a look at the legislation and talk about how that informs and supports the work that we're talking about here. And then we'll open it up for questions. So to start with, I want to take a little bit of time and talk about the information sharing, its purpose and its vision. The purpose really is to ensure that as we are working together, and we've been working together for a long time, we have often worked in collaborative approaches in the past, but there's a change that is afoot, and that's to ensure that we really embrace collaboration and provide for the best services. So in order to do that, we have to shift our culture because we are a very risk-averse culture, and we have to do a better job of managing risk. So we're moving from a risk-averse environment to one where we properly manage risk. And the vision in doing that really is to take a look at how information sharing itself improves service delivery to Albertans through increased collaboration across the government and service delivery partners. Information sharing is not the goal in and of itself. It's really about how do we inform and support collaborative approaches. Guiding information sharing practices leads to improved outcomes for individuals and families. When we do it properly, we create a balance. And if you look on the right-hand side of the slide, you'll see that there's a number of things that we're trying to balance. Part of that is taking a look at how do we ensure that we're still paying attention to the privacy requirements, as well as taking a look at ensuring that we're supporting the best outcomes possible. So if you think about that, there are certainly concerns that arise. And an example that sometimes comes up is, well, if I'm going to talk about risky behavior that perhaps an individual has exhibited in the past, is there not a risk that by identifying that risk, people are going to be treating that individual differently? It's really important to recognize that if we don't identify concerns, if we don't identify issues, we're not going to be able to deal with them properly. So it becomes important to bring those concerns forward, identify what the behaviors are that maybe need to be supported or addressed, and then by having a group of professionals who are working on that or who identify and understand the concerns, then we can start to move forward and really address the issues and get to the best supports possible. So, information sharing in practice. Really, the whole information sharing approach is based in a number of principles. First of all, it's a person-centered focus. So we really want to take a look at the individual. An Albertan has certain needs at times, and we have to identify what those needs are and how we're going to address them. Looking at it more from the individual's perspective, as opposed to looking at just fitting into program requirements. So that person-centered focus becomes really critical. It allows us to start moving forward from a holistic perspective. And information sharing facilitates that comprehensive, coordinated, or integrated service approach, as well as planning, monitoring, and evaluation, enabling shared case planning without compromising privacy. And that's an important piece. We do pay attention to the privacy legislation. Everything that we're talking about has to be done within the context of following and being in compliance with privacy legislation. We only want to share the information that's appropriate, authorized across the Government of Alberta and with its stakeholders, the external organizations that we work with, that some of you are part of, in order to support the effectiveness and efficiency. And as we identify risks, there are certainly risks associated with sharing information, and so we have to do that properly. But we also have to take a look at the other risks, the risks of not doing anything, health and safety risks, and so forth, and then balance those different risks within a culture that both promotes the sharing of information, but in a way that continues to comply with the requirements under privacy legislation. As well, there's an accountability for the information management, and we have to make sure that that is in place and understood by all the parties. So we do have to spend some time to talk about what are the roles and responsibilities of the individuals that are involved in providing services to the individuals that we serve. When organizations work together to provide collaborative, coordinated, or integrated service delivery, then we can ensure that Albertans are actually achieving or receiving the benefits and services that they require in order to propel them forward and to be the best that they can be. Now I'll talk a little bit about information sharing and service delivery. First of all, sharing information really results in increased communication and more informed decision making. If we work in isolation, we're not going to be able to achieve that. It allows organizations to share personal or health information for case planning to identify critical supports and services that meet the needs of Albertans and their family or caregivers. It also enables the risks to be managed properly by ensuring that organizations are informed about urgent supports that an Albertan might require. It also helps identify any health or safety risks that the Albertan, the staff, or others could experience. I'll give you an example here. If you think about someone who's receiving perhaps mental health services from a mental health therapist, that therapist might be seeing the individual once a week, maybe once a month, but they're not always able to monitor whether or not the intervention, the services that they're providing, are actually resulting in any behavioral changes. So they have to start to rely on others to be able to act as their eyes and ears. If the individual is also in a group home or in a placement where they're being observed by others, then the staff in those facilities have the opportunity to be able to take a look at then sharing what they're seeing in terms of the behaviors, whether the behaviors are diminishing or escalating, and become truly the eyes and ears then for the therapist. It does require then that the therapist not only provides the services, but relies on those individual staff to provide some feedback mechanisms and perhaps to have discussions with them about what sorts of interventions, outcomes they're hoping to achieve so that they can monitor for those sorts of things. So it really does become a discussion that needs to take place about how do we provide the best services for that individual. Now, there's certainly risks related to information, and we have to identify what those risks are. There are information sharing program controls that need to be established through policies, and part of the policies that PDD has put in place do establish some of those controls and do address those issues. That way, we ensure that a program or service is delivered in a collaborative, coordinated, or integrated manner to meet the desired outcomes, but in a way that still manages the information appropriately. Partner organizations need to develop information sharing policies that address key confidentiality, privacy, and security practices, including things like identifying the authority to collect, use, and disclose as well as retaining the information. Providing notification, being very transparent about what it is that we're trying to achieve, the type of information we're going to be using, and how we're going to manage that information. And that's part of the notification process. Using consent where required. Establishing information security controls, such as technical, physical, administrative controls. We don't want information to be accessible to those who don't have a right to have access to it. As well as offering competency-based training. And there's a lot of different areas where we need to develop some of those training. The PDD program put program controls in place by updating their policy and using the draft health and safety document summary that you'll learn about shortly. If we think about some of the information that we gather, for example, we have a number of areas that rely on assessment information in order to be able to determine what services are required and how we're going to fill gaps or capacity issues that might exist. If we think about using that assessment only for the program or for the service that initially identifies the need, then it becomes very difficult in the future for others to not have to redo the assessments. So part of what we need to look for then is how do we ensure that we think about the long-term need for information flows and how we then support those long-term needs by sharing the information going forward so that we don't end up duplicating some of the information collection that we currently do. Within the collaborative information sharing environment, information has to flow between the Government of Alberta through various programs and our service provider partners. Those risk assessments are a valuable piece of information that informs the design of case plans and delivery of services. Providing access to those assessments done previously will inform the identification of risks going forward and as well potential ways that we can mitigate those risks. The sharing of current risk assessments between service providers, including the government staff, will ensure that all of those involved in supporting the individual have access to the same information and it can be coordinated properly. Now I'm going to invite Twyla back up and she'll talk a little bit about the information sharing policy.
Thanks, George. So my role today is really to talk to you a little bit about how the collaborative information sharing environment applies to the Persons with Developmental Disabilities program and the updates to our policy. And so just a few highlights around the policy. So the first thing is it gathers information that's currently in the program policy and places it in a single area so that we can really reflect our information sharing objectives. And it provides some guidance around the use and collection and disclosure of personal information, really around how the program is about to set that up and what it means within the context of other GOA programs and the information sharing strategy, as well as giving guidance around notice and people knowing when we're collecting information from them and how we're going to use that information, as well as an introduction of the new health and safety document summary, which talks about a draft document that is intended to help us share information, ensure that we're sharing what's important at the right time. So this policy direction is really about reflection of our program principles and ensuring that the way that we're sharing information and that we're approaching that collaborative environment fits within the overall information sharing strategy, and that it looks towards developing a collaborative environment with the individuals while we're developing services and supports. Because really the primary person we gather information from, the individual and or their guardian, is really looking forward to us using that information. There's a purpose to it around the delivery of supports and services, and we want to ensure that we have that and that we include information that's collected from all of our sources. So that includes information that other service providers might have, FMS administrators, and we're accessed through other forms of service delivery. And so gathering all of that information up and making sure that it is provided at the right time to help us design and deliver services. So a further note about this change in policy is that the policy will be posted to the public website. And I went backwards, so there we go. headed in the right direction. Now I want to spend a little bit of time talking about notice and notification, and really what does that mean within our program context. As George was saying, that the legal requirement under each of Alberta's privacy laws is really important, and we want to make sure that people understand when we're collecting and gathering information, and that they have notice about when that's occurring, and that individuals have been informed about what we're collecting and the purpose for that, and really the authority about how we're collecting it. So in the PDD program, authority flows from the legislation and talks about our ability to develop services and supports for individuals. And it gives us an opportunity to engage with people who are accessing the program about their information and how we're able to use it to coordinate services and supports. And really looking at defining the roles between the different parties. And so that notification happens through a common notification process that we're going to talk about here in just a minute. So when we think about common notification, what does that really mean? And how would people know that it's been done? Well, through the information sharing strategy, common notification is the process that you see through the application to the PDD program that talks about notifying people that the program is going to collect information and how it's collected, and that we disclose it in various ways to develop supports and services. And really, agreement is gathered at that point, and we want to really look at ensuring that people understand the purpose of when we're collecting information and our authority and how they can ask questions. So at each point in time during interactions with the program, what you see is that you see staff reminding people that we're collecting information, how we're going to use it, how that information might be disclosed to help us coordinate and collaborate to provide services and options. And so really looking forward to that overall piece that tells us through common notification what the purpose of collecting information and disclosing information is, our legal authority, and how to contact people. And so you'll notice that it's a really important point to us that people understand that, and so it's part of that initial application, and it will be brought up at the various points in time while we're collecting information. So one of the things that has typically been part of our program is a notice of consent to disclose. And so when you think about the current information sharing strategy and the common notification process, what you now see is that asking for specific information to disclose information is only sought when it's not already authorized through the program and through common notification processes. And so generally you won't see a lot of consent to disclose information forms being presented as somebody who would access the program, because that original common notification is done and people are reminded. So there's opportunities to talk about the collection and use of information, and that you wouldn't necessarily be asked about specifically providing consent. However, there are instances where you will be asked to do that. And in particular, those instances refer to opportunities where we don't have authority, where we're using information that's not necessarily about setting up specific services and supports through the program, but it might be through other GOA uses, etc. And so it really is an opportunity to ensure that you understand the authority to do that, as well as for all public bodies, right? So for example, Government of Alberta, to ensure that we're in compliance with the information sharing legislation, and that we've looked at to the extent of the purpose of how we're using information and how we collect it. So when you do get consent forms, it's often about our ability to collaborate outside of the purposes of the PDD program. So for example, if you think about the coordinated application form to AISH, there's certainly some pieces of information that we use through coordinated application and that allows us to set up common services. Well, other pieces are not for that purpose, and so there's a unique consent form that's signed. Or when we're collecting information during eligibility, and we may be gathering information from other sources for that purpose, such as schools, and you may receive consents to disclose information forms at that point. So if you think about, now that we've talked about notification and how you're told about we're going to collect information, how are we using that information, and what are the common ways in which we do that? So the process of setting up services and supports is often divided into a planning phase and then a delivery phase. And so in planning, we need access to information to ensure that we are being collaborative and that services and supports are set up using the best information possible. And so there's two common ways or documents that that information is shared. And those are the PDD outcome plan, as well as the new draft health and safety document summary. So if we think about the process of setting up supports and services, an initial step is to determine if a service provider or an FMS administrator is able to set up services and supports. And so a PDD outcome plan is used in that point, where we talk about a summary of information and how do we ensure that the people we're approaching are actually able to provide the supports and services we're requesting. And that's when that document comes into play. Once PDD outcome plans have been shared and we've looked at the potential or have a service provider or FMS administrator indicate that they're willing to enter into developing a service or a support, we then would look at providing the health and safety document summary. And this is a more inclusive set of information that's really intended to ensure that the supports and services that are put together are appropriate for the individual and encompass all of the information. So it's really about, as George was saying in the strategy, having the right information at the right time to make good decisions around services and supports. So let's talk a little bit about the draft health and safety document summary. So this summary is really a tool that's designed to provide an inventory of all the information related to health and safety and highlights the significance of those documents that we have access to. And it's designed to ensure that we're sharing the most important information as needed without really providing so much information that it's impossible to tell what's significant or important. And it's provided to service providers and FMS administrators once they've indicated a willingness to engage in planning with the intent to provide a service. And so it's really about having that information far enough in advance in the planning process to incorporate it into what it is we're doing. And so optimally, that document should be provided about 60 to 90 days prior to the start date of a service. And as I say that, I know it sounds like a huge time frame, where we're thinking 3 months in advance of me even being able to get services, but it takes time to develop a good service and to really work with our partners and ensure we've considered all the things that are important for the health and safety of individuals and service providers and caregivers, and to make sure that that design process really, if we have the time, uses the time we have available and the information in the best way possible. However, sometimes we set up services and the timeline is much shorter than that. And we know that and recognize that at times there's an ability to move forward to accessing supports and services much quicker than 60 to 90 days. However, we still need to have information that's shared at that point. And so in those situations, including emergency situations, the health and safety document summary should be provided prior to the start date of those services. And it's really intended to ensure that all the available information is present and included in our planning process as we have it. So let's just have a little bit of a look at the draft document. And so recognize that this is still a draft of how the document will look in its final form, but we wanted to give you a little bit of a flavor of what kind of information you might find in the inventory. And so it really is just that, it's an inventory, and it includes all of the information we might have available. So within individuals' information that we have collected, service providers have collected, FMS administrators, and so it summarizes all of those into a single document. And it looks at providing a complete listing of all of the documents by type. And so even though we might have a type that says risk assessment or a medical assessment or other assessments within that document, you need to recognize that at times documents are not named consistently. And so sometimes we might think of a document as falling in one category, but it might appear in another category. And really the intent is to ensure that all relevant documents are listed within the inventory and we're able to identify them. As well, we're able to identify the significance of a document. And so this isn't to provide a summary or to interpret the document, but it's to give a hint about what it might contain and to ensure that we've attached or provided actual source documents that are the most relative. And so sometimes when we think about time frames, we might have a number of historical documents, and we really want to look at providing those that provide the best information during the process, the planning process, they're consistent, that people have access to the right information from that at the right time, without looking at volumes of information that may or may not be relative. So what are the roles and responsibilities as we look at the new policy and the draft policy and the draft inventory document that's coming out? We really started to think about how would we accomplish this? If our goal is to share information in a collaborative environment and ensure that we have the right information at the right time, how do we do that? So for regional staff, it's really about developing and updating the draft health and safety document summary and making sure that all of the documents that we've received are included, that they provide a copy of that document and the identified attachments to a service provider or FMS administrator as they've indicated their ability to or intent to develop a service and to enter into that stage of planning, and to ensure that it's updated as information is received. So sometimes during the course of service delivery or collaborative planning, we find new information or receive new information, and we want to make sure that that's available, and it's available to everyone who requires it. And so it's really going back to that principle that George was talking about providing the necessary information. It's not about oversharing, but what's necessary to ensure that we're using health and safety information to ensure the safety of individuals, caregivers, service providers, and that we have the right stuff at the right time. And so really looking from a service provider or FMS administrator a set of responsibilities, it's about providing copies and making sure that available information is included in the creation of the inventory document. So at this point, I'm going to turn it back to George to talk a little bit about the privacy legislation. Sorry, George.
Thanks, Twyla. So what I'd like to do now is talk a little bit about the privacy legislation and some of the things that are common and some of the things that are different. We work in a very complex environment in terms of legislation. We have a number of different pieces of legislation that have to be considered because we work with many different types of organizations. I also then want to tie it back to some of the things that we've been discussing and how it is that it supports the work that we're trying to do here. So the first thing I'll start with is the FOIP Act, the Freedom of Information and Protection of Privacy Act. That's the act that applies to PDD as a program within the public body organization called Community and Social Services. And it applies to many of the other organizations that we work with. Other government departments are all public bodies, and they're all subject to this legislation, as are school authorities, police services, and so forth. The FOIP legislation really speaks to how you manage and collect information and ensures that there's processes that have to be followed, that we follow security processes to ensure the information is managed appropriately, and so forth. It protects privacy by setting controls around that. As well, the privacy legislation, the FOIP Act specifically, is under the purview of the Office of the Information Privacy Commissioner, who currently is Jill Clayton. The next piece of legislation is the Health Information Act. And the Health Information Act was brought in after the FOIP Act when it was recognized that there's a significant amount of sensitivity around health information, and there's a need at the same time to ensure that there's a good flow of that health information within the context of what is often referred to as an arena, a closed arena in this case, where health professionals can share the information that is necessary for them to do their work. There's an implicit consent process buried within that legislation that allows for that flow of information to take place. And that just makes sense. If you go and see your doctor and your doctor writes a prescription, the pharmacist has to fill that prescription, so he needs to know what the prescription is about and sometimes what the prescription is for so that he can give you advice about the conditions being treated. As well, that your doctor may refer you to a specialist, may refer you to do some lab work as well. And all of that information is dealt with within the context of providing you with the health services that you require. So it needs to be able to flow fairly freely amongst all of those health custodians or service providers. We also brought in the Personal Information Protection Act, which is a piece of legislation, privacy legislation, that applies to the private sector. It applies to organizations that are dealing with personal information or other types of information within the confines of the Alberta jurisdiction. So there is a federal version of this as well, called the Personal Information Protection and Electronic Documents Act. That one applies to undertakings that fall under the federal sphere. And Alberta would have had to follow that legislation if we didn't bring in something substantially similar. So as a province, along with BC, we chose to bring in the Personal Information Protection Act. Now that's a bit of a different piece of legislation. It applies again to personal information that's managed by these organizations, but there's a carve-out that has taken place in that legislation. So that Personal Information Protection Act, or PIPA, does not apply to the not-for-profit sector, by and large. There's a few organizations that do fall under it. What that means is that we have organizations in Alberta that are not subject to any privacy legislation, and that being the not-for-profit sector. But there's exceptions, and there's always exceptions in legislation. So one of the things that occurs is that if an organization, a not-for-profit organization, deals with information, personal information of an individual, and charges for that, it becomes a commercial activity, and then it is subject to the PIPA, but not the organization itself. So I'll give you an example of where some of this may, where we may encounter some of this. We work with a lot of contracted agencies. We contract with a host of different organizations, and many of them are not-for-profit organizations. By contracting with them, we pull them under the umbrella of FOIP. And that means that through our contract, we require the agencies to do things in a certain way so that we can continue to maintain our accountability for how that information is managed under the FOIP legislation. And for that purpose, then, we have to ensure that the contracts are followed and so on. We have to make sure that the organizations understand how to use the information in a way that does maintain our accountability. And in some ways, and under the legislation, that organization, or anybody who's acting on our behalf really, becomes deemed an employee for the purposes of the privacy legislation. That allows us to give them the information that they require, allows them to collect it if that's what's stipulated in the contract, gather that information in order to provide the services that are identified under the contract or the agreement. That can also help with, that can also happen under the Health Information Act. So we may have the same contracted agency that is also providing services under Alberta Health Services contract or agreement. That means that that agency now gets pulled under the Health Information Act and is seen to be an affiliate under the HIA, the Health Information Act. So we've got some complexity that comes into play there because we have different stipulations under those two pieces of legislation. Not to mention that we also have different contract language and expectations sometimes outlined in those contracts. That organization that contracts now with those two organizations may also contract with a federal institution. And as such, they would then fall potentially under the Privacy Act, which is the federal privacy legislation that applies to organizations like Health Canada, the RCMP, and many other institutions. So it becomes even more complex. And yet that organization, as an organization, is not subject to privacy legislation on their own. We certainly would expect that any organization we do business with understands what the requirements are in terms of managing information appropriately, and there are things that we do to ensure that that does take place. So we ensure that there's certification processes and that accreditation processes or approaches, and that we provide training where necessary or guidance where necessary on how to manage information. And more explicitly in the contract itself, we will identify certain things that have to be followed. But it can be very complicated. So when we look at all of that legislation, again, I mentioned that Jill Clayton is the Privacy Commissioner under FOIP. She's also the Privacy Commissioner for both other pieces of provincial legislation, being the Health Information Act as well as the Personal Information Protection Act. There are provisions that allow for the sharing of information, that allow for the use of information across those organizations. And the Privacy Commissioner has taken a look at our strategy on how we enable some of that sharing of information by interpreting the legislation and by making the legislation work together. And she's very optimistic that this is the right thing to do, and she has weighed in, certainly given us feedback at times, but generally recognizes that we cannot work in isolation. I mentioned earlier about the mental health therapist and how that sometimes we have to become the eyes and ears for that therapist. That's in recognition that we don't have the capacity within one organization to do everything for the individuals that we're providing services to. If we don't have that capacity ourselves to do, then we have to work with others. And we can't work with others if we don't share information. The Commissioner gets that. She totally understands that there is a need to share that and have information flow amongst all of those partners so we can get to those best outcomes that we talk about. But in order to do that, we also have to make sure that we're managing the information appropriately, and that's where she has an interest. Now, sometimes people have said, well, if I'm going to share information, then there's a risk of my getting in trouble. I'm afraid that I'm going to get in trouble because I don't understand the legislation, so it's probably easier for me just not to share and not disclose anything. Well, that may be true from the privacy perspective, that you're now safe because you're not sharing any information. But think about the risks about not sharing. So if you don't share information, you're as accountable for what you don't share as for what you do share. And if you know of certain information that needs to be shared in order to prevent health and safety issues, and you don't do that, then there's you're really into not only an ethical dilemma, but there's moral obligations and other obligations that come forward. And I'll talk about health and safety under the privacy legislation in a minute. The Commissioners, though, and her office staff are very interested in supporting good practice. There are people that are afraid they're going to get in trouble, not only maybe with their manager or their organization if they share too much, but with the Commissioner as well. And the Commissioner's perspective is very much about doing the right thing and helping organizations to understand what that looks like. So they're not out to do witch hunts. Of course, if people are going to be stupid, if you're going to have access to a database and go in and snoop on your ex-spouse's partner, new partner, you're going to get caught and you're going to get in trouble. And that's just being stupid. But if you're using information for the right reasons, and even though we may think we have all of the information we need when we make a decision, sometimes there's something else that comes along that we're not aware of, perhaps, and maybe that wasn't the right decision. Those are called good faith decisions. When we make decisions in good faith, thinking that and assuming that we're doing the best thing that we can for the client, and part of that then is getting the information you need to make the good decisions. Those good faith decisions are protected under the legislation. So there are provisions in the privacy legislation that prevent you from getting in trouble if you make a good faith decision. You have to be able to explain the rationale as to why you do things, but that's just good practice. So in the privacy legislation, I mentioned that there are a number of provisions that do allow us to share information. Certainly, the first one, the primary one, is that we can use information for the purpose it was collected for. One of the things that we often hear is that under privacy legislation, you can only give the littlest amount of information possible in order to achieve a purpose, and in as anonymous a way as possible. So people translate that sometimes to mean, I can't tell you really anything other than maybe the person's name or very little bits of information. And I'm not even going to tell you who it is that I'm working with because we have to be anonymous. Well, if we've got a number of organizations that are working together to support Bobby, then it's okay to talk about Bobby. Bobby is the person that we're providing supports to. So anonymous a way as possible really is dependent on the situation. And when we're working in a collaborative or in an integrated manner, we have to be able to recognize who it is that we're talking about. By and large, that isn't an issue. If you're referring someone over to some other program that is totally disconnected from ours, then there probably is more anonymity that needs to come into play. The least amount of information, you really have to have a discussion with whoever it is that you're looking at sharing the information with to find out what it is that they actually need in order to provide the services that they require, and how it is that they're going to use that information, and then you can make a more informed decision about whether or not you're going to share the information. If I make assumptions about what you need, I'm really not understanding necessarily how you're going to manage that information or why you require the information, and it may not be in the best interest of the individual for me to not share more information. Sometimes that means that there has to be a bit of a dialogue. So if I have information about Joe, and I think you've got some information about Joe that I need to have access to in order to provide better services, and I ask you for that, you may look at what you have and think, well, no, I'm good. I don't have to share any information. But if I explain why it is that I need the information, what it is that I know about Joe, and how I'm going to use that information, now you can make a better decision because you're going to start to understand both the reason I need the information and how I expect to manage it. and then you can make a much more informed decision. Under the FOIP legislation, there's as well the ability to share information for purposes of integrated or common programs or services. And that's one of the ones that we rely on fairly heavily, that we are looking at collaborative approaches, building that basket of supports around the individual to address their safety needs, their health needs, and other needs. And by doing that, we're now saying that we're working in an integrated manner to achieve the best outcomes. And the legislation allows that to happen. As well, it allows us to disclose information for purposes that are outlined in other legislation. So we often look at this legislation in conjunction with the Health Information Act or other pieces of legislation in order to provide those best supports. As well, there is the ability to share information with a law enforcement organization. Sometimes we have individuals who have issues, mental health issues as an example, that sometimes cause them to behave in ways that are not deemed to be normal, that get them into trouble. And it's much better if for example, if we're working with the community policing side, for them to understand that there's a place for that individual to come home to, rather than if they have to pick them up off the street, that they take them off to jail. It doesn't necessarily serve best interests of that individual to look at it only from a law enforcement perspective. If we can bring that individual back home and ensure that the supports are there, police would need to know that that individual has that place to go to. So there are areas where it makes a lot of sense to work more closely with police services, law enforcement organizations. The last one I want to touch on is about health and safety. All privacy legislation have provisions that allow for the sharing of information for the prevention or reduction of potential harm from a health and safety perspective. And that just makes sense. For me, and I've been working in the privacy field now for, well, almost 20 years, I would much rather take the risk of breaching someone's privacy and eliminating risk of harm, risk of safety issues emerging, than to not share information and find out that something went gravely amiss. And we've seen too many situations where people have died as a result of people not sharing information. So the health and safety clause is a safety valve that does exist across all of the privacy legislation. Now, when I look at the privacy legislation, there are certain things that are very common across them. So first of all privacy legislation that creates an authority. It gives the authority to the organizations that are subject to that legislation how they can use that and collect information. As well, they often speak to the disclosure of information. So collection, use, and disclosure become very important components of all privacy legislation. It talks quite often about both the direct collection. So this is where we talked about the common notification. If we're going to collect information about you as an individual, then you have a right to know why it is we're collecting that information and how we expect to use it. So thinking back to that common notification that Twyla talked about, what we say there is that we're going to be using the information to provide you with the services that you require. In the past, we used to say that we're collecting the information only for the purposes of PDD or for AISH, and that we would not use the information for any other purposes. Well, what that did is that started to create silos that didn't allow for the good flow of information that is necessary. So if you think about an example, an individual with a disability, we have many programs that support individuals with disabilities. And in the past, every one of those programs would require you or your caregiver to provide and prove that you in fact have a disability. That proof has to happen over and over again. And that really doesn't make sense. When we've got an individual who's a youth or a child with a disability, when they turn 18, it doesn't disappear. It continues with them. And certainly there are advances in technology that allow us to do much better, to allow people to do much better themselves. But the disability still doesn't go away. So to ask a person to prove time and time again that they have a disability for a government-run program really doesn't make a lot of sense. It also doesn't make a lot of sense because it taxes the other professionals that are involved in providing supports. So if we go to a doctor and ask the doctor to fill in a form, and then when the person turns 18, we ask them to fill in the form again, and maybe 5 times because we got 5 potential programs that that person's applying for, that's taking a lot of valuable time that that doctor could be using elsewhere. So there are certain things that we've taken a look at that we recognize when we get information, we have to think not only about what it is that we're providing at that point in time, but how are we going to use that information over the lifespan of that individual? And how do we support that person potentially over that lifespan? And we have a number of programs that follow that individual in certain places in time, but then we can move some of that information across. Twyla also mentioned, for example, the use of information for PDD is often also information that's necessary for the ACE program. So by solidifying the approach, then we don't have to have the person go through duplicate application processes. We can share the information and allow that person to move in a much more streamlined way through a number of different program application processes. And that becomes really important because we've got a lot of better things to do than to just always fill in paperwork. As well, it makes sure that we have a continuity in terms of the assessment information or other information so that we can ensure that as an individual moves perhaps from one age group to another, that we continue to support them as best we can, knowing the information that has already been gathered. So when we look at some of that collection then, the collection, we often have to talk about then that broader use, and it's not just a narrow inch-by-inch type of approach. We also have to think about who else is going to be involved in providing some of those services, and that notification then clicks in there because we need to be very transparent about letting you know who it is that's going to be involved in providing care or supports for the individual. That works across all of our legislation. So the consistent use becomes much broader instead of a very narrow focused approach. And then there's other uses that I've talked about already, some of those provisions that exist. Sometimes we have to take a look at the information a little bit more globally. So not only do we need to provide services to the individual, but we also have to think about, so how good a job are we doing in providing supports to the overall population? And that means that we have to be able to use data, and that data comes from all of the individual's information in order to assess, are we doing a good job or not? Are we hitting the mark? Are there gaps in our policies or practices? And we have to be able to report on that and how well we're doing. So there are some other uses that are kind of behind the scenes where we have to use not only the identifying information to support the individual, but we also have to use some of that identifying information, usually at a population level though, across many individuals, to see whether or not we're getting what we think we're getting when we create the programs and provide the services that individuals require. Now, the notice we've talked about, that exists across all privacy legislation. And again, if we have to collect information directly from the person, then we have to provide them notice. If we're collecting information through another person about that individual, we should still make sure that they have an understanding as to how it is we're going to use that information. And that's just being transparent. But there's other additional common elements. So people have a right to know what we have about them, and people can make access requests. And as we work together, we have to think about, how are we going to do that? How are we going to provide information back to the individual? And we should be able to do that in as informal a way as possible. So many of the documents that we create, people should have a right to take a look at those documents, look at the information that we're collecting, and that becomes part of our transparency as well. All of the privacy legislation have requirements that we manage it properly, and that's where the Commissioner's Office has oversight in order to ensure that if somebody brings forward a concern, they can take a look at how we're doing things and that we do things well. And the last piece there again is the health and safety. And to me, that has always been a critical component within all of the legislation. So now I'm going to turn it back over to Twyla, and she'll do a little bit more of a summary. Thank you.
So just taking a minute to talk a little bit about what kind of information did you learn? And so I know that throughout the presentation, George had lots of information, and we certainly had some information around the policy. And I just want to talk to people a little bit about ongoing resources. So where can you find additional information or go back and review some things? So one of the first places you could go is to go to the infosharing.alberta.ca website to learn some more information about the Alberta government's information sharing strategy and to have a look at those. when the PDD policy posts in its final version, there's some updated case scenarios that will be included that provide examples of how to apply the information that's within the policy documents and how that will be applied during casework. Additionally, there's some resources that are being linked into the policy, and that's the PDD program information sharing critical considerations, as well as a summary of access and privacy legislations to assist service providers and FMS administrators. So part of this set of information is to ensure that you have access to resources and documents that will help you understand your role and responsibility as we move forward with the information sharing and the use of information within the program. Additionally, there's some online resources or online training and access to resources available through the servicealberta.ca website, FOIP, as well as the infosharing.alberta.ca website. And so in those sites, you can access additional training and resources. You can learn more about the FOIP, or Freedom of Information and Protection of Privacy Act, through the servicealberta.ca site, and about HIA, or the Health Information Act, through health.alberta.ca /about/health-information-act, right? Fortunately, it's written up behind me, so hopefully people are able to access that as quickly as I'm talking about it, because it's a bit of a mouthful. So really encouraging people to access some of those resources, and they'll certainly be embedded within the policy documents. At this point, we want to invite people to ask questions if they have them, and I'll get George to join me for that. Nicole?
Yeah, we have some questions. Would an individual who is their own guardian have access to the inventory of information? For an example, they have an individual being told to FOIP their own assessments.
Okay. Do you want to start, George?
So individuals do have right of access to their information, and the mechanisms by which we do that, we really should be as transparent as we can be in providing information back to the individual that is about them. Now, there may be times that there's information that's gathered that has a certain sensitivity to it. So, for example, if we had an individual who has a mental health condition and the therapist is very concerned that by sharing information back to them in an unstructured way, that it could create risk of harm because it might trigger certain things, we have to be aware of those sorts of things and manage that piece as well. But I would say by and large that most of the time we should be able to give information back to those individuals. Sometimes it also collects or contains information about other individuals, and then we do have to go through a more formal process in order to really take a look at taking out the information about others.
Will the inventory be a digital record, or are we talking paper documents moving around?
They are paper documents moving around. And so one of the issues that necessitates it being a paper document is it's not easily transmittable information, and most of the documents that are received are in paper format. So it's not easily transferable to electronic documents at this time.
But that said, we will be working with PDD as well as with other programs to move us more and more into the digital world, where we are not only able to transform some of those documents that are currently paper into digital, and that's by scanning them really, but more and more we're moving into being able to collect information directly in a digital way and then making that available that way as well.
Thanks, George.
Will the full documents referenced in the health and safety document summary be attached to the summary to allow organizations to dig down into what's relevant?
Yes. So within that summary or inventory document, there is an indication of which documents are attached based on significance, and they're certainly open to discussion about other documents, but the intention is to provide an overall inventory of what's available and then to attach the most pertinent or relevant pieces of information.
Is it a given that a service provider can request a document listed on the inventory and receive it? Or would that request ever be turned down?
I can't think of a situation where we would naturally just turn it down. There might be some discussion about how many documents people are receiving and the ability to sort for the most relevant information. So for example, I can think of cases where individuals have been in service for a long period of time. And what we wanted to avoid was bringing hundreds of pages of documents and really being able to highlight the most important things and then talk about what else might be there and how that might best be used or contribute to individual service planning.
As new information is gathered by organizations, how and when would it be provided to PDD as an update to the health and safety document?
The information that is normally gathered or provided back to PDD is mandated within the contractual requirements in PDD policy now. So there are certain time periods where we're required to collect documentation. For example, updated risk assessments are to be shared directly with PDD. They would then become part of that inventory or record, which would then be shared with all service providers involved at that particular time for that individual. So it should be a flow of information that's quite dynamic. For some individuals, it could be a flow that happens multiple times over a service year or during a service period. For others, it could be a slower progress, but the collection of that information is outlined within monitoring and is agreed upon when we start with services.
Will quality of information and timelines of information sharing be considered in these processes?
Nicole, I'm going to get you to repeat that because I'm not sure I understood the question.
It says, will quality of information and timelines of information sharing be considered in these processes?
I wonder if they're meaning timeliness of the information.
Oh, yes, see, it says here, there's a gap. They explained, yeah. If there is a stated process but a gap in the reality, then how does that improve with this new policy?
So the policy provides some clear direction around roles, and what we're looking to do is to avoid those gaps and to really work forward to ensure that we have an accurate, up-to-date inventory and documentation, and that it's shared at the appropriate times. And so I can't guarantee to somebody there'll never be a gap, but the process and design of this really looks at defining those roles and responsibilities and ensuring that that's what we're moving towards at all times.
I don't know if this is fully on topic, but they're saying their agency requested that AISH and PDD consider sharing information that will result in easier ability and removal of barriers for people accessing disability tax credit. And it was turned down, and they're just wondering where they'd find out why that was turned down.
I'm going to hand this one to you, George.
So certainly there's still a lot of confusion about what information can be shared. This is a relatively new approach that we've been undertaking. And there's a lot of different practitioners, and as you heard me talk about the privacy legislation, there's a lot of confusion about what really does it allow people to do. So one of the things that we certainly offer is that if anybody has questions about ability to share information, they can contact our office and we can guide them through the process. And then we can also work with the organizations that are managing the information to better understand the sorts of things that they can do. So we still get questions, for example, can an AISH medical be shared with other organizations that are providing supports to individuals? And generally, the answer within government and our partners is yes, but we do have to take a look at what is the intended use. And if the intended use is valid and the organization that is going to receive the information is able to manage it appropriately, then generally it's going to be that we can move in that direction or we can enable that to take place. But there's a lot of people that are still getting up to speed about what it is that can be done. So part of our role in my office is to ensure that we help understand what the issue is and then work through the process to hopefully get to where we need to.
And this is the last question. Because disability does not just start at 18, are there plans to start collecting data at an earlier age?
There is data collection at an earlier age depending upon the source of the documents. And so individuals who as children begin to access programs and services and supports do begin to gather information. And so there's certainly some collaborative sharing that happens between programs during transition at age 18. And so if we think about transition from FSCD to PDD, there's certainly some sharing that goes on during that time, where people are informed that this is how that information is being brought forward. With other programs, the transition process isn't as clear. However, it should still allow us to have collaborative information sharing. We know that people just don't turn 18 and start with a fresh slate, and so we want to ensure that that information continues. George, do you have any other comments about that one?
Yeah, there's a number of transition points between our programs, and we are certainly examining how do we ensure that there's a smoother transition and that we really push forward and enable services in as timely a way as possible. At the other end of the spectrum, when we have people that are transitioning off of our adult programs into seniors programs, we have the same issue. And so we're looking at how do we ensure that we're able to do that as smoothly as possible so that we don't create gaps. In the past, we've had concerns that people didn't want information shared, for example, when their youth who may have been receiving FSCD supports was transitioning to an adult program. There were concerns about their privacy and not wanting to share that information. Unfortunately, what that does is it doesn't allow for good planning to take place, and then sometimes the services as a youth and the services as an adult have not yet been enabled, and that gap creates problems. And so really what we wanted to ensure then is that people understand that it's really in the best interests of the individual to provide the information that's necessary to the adult programs or the next programs or any partners that we're working with to allow for a good basket of supports being created and following that individual throughout whatever service requirements they might have. By doing that, we avoid gaps, we avoid creating problems, and unfortunately, when gaps are created, sometimes the issues become more escalated because the supports aren't in place. So part of what our role has been in terms of the overall information sharing strategy is to examine where are those touch points, where are those things that we can do better, and then how can we allow support and manage that information in a much cleaner, smoother manner.
Thanks, George. So if we've concluded the number of questions that were sent in today, I just have some information to end us off. So I just want to thank everybody for joining us today, and we hope we found today's conversation informative and helpful. As I mentioned during the introduction, today's webcast is part of the Government of Alberta's Community and Social Services Learning Series, and it will be running the third week of each month through June of 2018. And so the series covers a number of topics from PDD, like the one you saw today, but there are also series that talk about the Alberta Brain Injury Initiative, employment issues, Fetal Alcohol Spectrum Disorder Initiative, or FASD, and the Office of the Public Guardian and Trustee. To get updates on registration information about the sessions, you can email me at twyla.harris-olson@gov.ab.ca and ask to be added to the email list, and so that you can receive invites. You can also access the recordings of the previous webcasts and at the CSSLearningSeries.ca, which is all one word, website. So last year we will be posting up information about upcoming webcasts in advance to give you a chance to sign up and save the date so you don't miss out on any of the information. So as mentioned in today's webcast was recorded, and the video will be posted online along with videos from the previous webcasts. The video link will be sent out to all registrants in the near future, and we encourage you to view the video and to share it with anyone that might be interested. If you have some feedback about today's webcast, you can email me at the address I had provided you before, which is twyla.harris-olson@gov.ab.ca, and let me know. You'll also receive some feedback email from us shortly. So have a wonderful afternoon, and we hope to see you next month.
Thank you.
Thank you.